Hi, my name is Michael Chikeen. The smartest people I've met have one common belief, that us silly humans really don't know much. For example, we still don't know why planes stay in the air, or how Tylenol or even gravity works. Yeah, gravity. Look it up. In today's distracted, clickbait, misinformation age, I wish we could all be less certain, more humble, and a lot more curious. Admittedly, I've been known to struggle with all three. So no more, no less, this show is my attempt to be that change. Thanks for joining me, and here we go. Hey everybody, welcome back to No More, No Less. I'm Michael Chikeen, and today I'm joined by Dr. Tony Iezzi. Yeah, no,
Yes. You
I
got
it.
it.
A clinical psychologist with 35 plus years on the front lines of trauma recovery and behavior change. Tony has served patients in London, Ontario for decades and teaches as a professor of clinical psychology at my old alma mater, Western University. We're digging into his book, Re-Enactments, Break the Behavior Patterns That Keep You Stuck in Trauma, Stress, and Everyday Life. It's a practical framework for spotting those automatic loops that hijack your day and learning how to respond with choice instead of reflex. Tony describes a reenactment as a recurring pattern across brain, body, and behavior that gets triggered in familiar situations and shows us how to interrupt it. So today we're going to map out some of these most common interactment themes and why they persist even after therapy and the steps that we can break the cycle in real time. Dr. Iezzi, welcome to the show.
Thank you.
So I guess we went into a little bit right there, but I'd love to hear in your words exactly how you see a reenactment, what it is, and how you came upon it.
Yeah, maybe a little background. Many years ago, I was working in a veterans outreach center in New Orleans. And so I was seeing a lot of Vietnam vets. And I was doing these assessments and, everybody, of course, agreed the war experiences, led to post-traumatic stress disorder and those individuals. But it became more obvious as I spoke with them that, oh boy, a good number of them had problems way before they went to Vietnam. So they had experiences with being abused as kids. They had parents who had mental health problems. They had parents with substance abuse, criminal history, and so these experiences, you know, started to make me think about, because we tend to think of an event happens, we have a reaction, and that's the problem. Not enough is given to recognizing what a person's history was before an event, because those experiences make that person sensitive to certain triggers. And I'll talk more a bit about that. So we would started to do a lot of work in treating PTSD patients and doing a lot of what we'd call exposure therapy. So you would expose them to what they feared the most. And so if the example, like in the book, we use the example of someone being mauled by a dog on the front lawn, you know, you would sort of go from least anxious to most anxious, exposing them to that experience, ultimately to being on the front lawn, petting a dog on the front lawn. And okay, success, and everything's good. But we started to notice, Melanie and I, my co-author, we went to the same graduate school, had the same mentor, so we were very in sync in terms of our thinking. And we started to notice that 2 years later, 3 years later, these patients would come back that we treated for PTSD, and they would talk about being lit up, a PTSD light up in response to everyday events, and they couldn't figure out what was going on. So why would bumping into someone at the mall cause a person to have their full PTSD light up? And by that, I mean the physiology is elevated. They can't think straight. They're sweating. They're uncomfortable. They're thinking about the previous or past traumas. And this was in response to just being bumped at the mall, which was an innocuous stimulus by itself. So we started to listen, pay attention, and it became obvious that it isn't so much what happens to you, but how you perceive an event. That's what dictates the response. In the trauma context, it's an obvious one. If you've been in a car accident, your legs shattered, someone in the other car died, and you can hear the family's reaction, that's really traumatic. And So anything like that, the date of the anniversary of the car accident, you know, the voice of someone upset, pain, all these things would trigger the whole experience. But it became more obvious that it's not just a brain, body, and mind response to this event. It's also, and we make an interpretation of themes. So each event, traumatic or not, have themes associated with it. So if you're in an accident and you shatter your leg, you know, the theme of helplessness, the theme of dependency, the theme of worthlessness, the theme of loss and control gets triggered. And what happens, Michael, is that then in everyday moments, like being bumped into at the mall, the themes get triggered.
Right.
And if the theme and your sensitivity to that theme is triggered, instead of being from 0 to 100 in terms of anxiety, instead of it being a 20 on its own,
Hmm.
because of your history, now it's an 80 and a 90.
Right.
And what becomes important is if we can identify the themes, then that's what we target in terms of treatment. So, do you want to treat anxiety in a general nebulous way, or do you treat, you know, a loss of control? You know, and so, and what you'll find
Interesting.
is the more you're specific in targeting those themes, the more likely the success will be what you would hope.
That is really fascinating because I want to try to put this into a larger box for context. Have you read How Emotions Are Made, the book by Dr. Lisa Barrett?
Yes, yes, yes,
Okay, so
yes, yes.
you had me thinking about that for as you said that how we feel is one thing, but the context of the world that it's in is more important, right? So
Correct.
like, and we have a lot. I mean, I don't know if you'd agree that a lot of people are saying that we need to pay attention to our feelings, we need to be connected to ourselves, but then there's a bit of context later that says, yeah, but not all our feelings matter. Not all of them are true. So how do we kind of slice that bit of context in between listening to ourselves for what our instinct is, if we're angry about something real or feeling sad or grief, or how do we slice that away from something that's like a reenactment or something that's coming up from our past that we need to perhaps deal with?
In general, reenactment or not,
Hmm,
you know, we get a lot of messaging that is anti acknowledging our feelings and emotions. And so we all grow up pinched and holding and and not acknowledging, and we move on. What we don't realize is in everyday life you get triggered and you have all this pent up emotion and feelings, and then they just kind of fall out, you know, and you're kind of like at
right.
a loss as to why this is happening and feel a bit crazy, but you're not, you know. So, in general, it's always, always a good thing to acknowledge and own what you feel. And if you do that and you work through that, you'll be lighter and you'll be more able to handle the world. But there's a lot of messaging. Here's an example: grief. You know, you lose someone. Society, the message from society is, you know, within a couple of weeks, you should be okay. Get back to work. You know, you're good. You know, and so that person is like, oh my God, I miss my, you know, my parent, my brother, my whatever, you know, and they're like holding this, you know, and people are like, okay, they're doing good, and then a year later, you know, our anniversary dates and these other dates trigger them, and they kind of lose it, and it all comes spilling out, you know, and they're wondering what's wrong with them.
Right.
Nothing wrong with them. In
Right.
fact, we have to tell patients, cry now every day for the next month if you have to, or two, and you'll be much better a year from now. But this always holding and pinching is very bad for us. But it's a very Western, you know, very
Capitalist based.
yes, yes, yeah. I'm trying to
Get
find the
o-
right word.
yeah, yeah. I mean, pardon my
Yeah,
language, but it's kind of like get over it and get the fuck back to work.
exactly,
All right.
exactly.
I mean, like it's a bit of stiff upper lip sort of mentality as well. I mean, so my question leading on to that, I was going to say like, so how does someone parse, what is something legitimate that they're feeling and what's something that perhaps that they need to deal with? Is just kind of like common sense if these sort of things are coming up and causing you pain in your relationships?
So you could think of it as how can we tell a difference between a normal reaction and a reaction that lingers and is more like a reenactment? So when you have something, a disagreement with someone, and you have it out, and a normal reaction is you have it, and then 2 or 3 hours later, or later that night, it goes away. But if it lingers that night and it lingers the next morning, even 2 days, and you're going like, he said, she said, and there's all this, I should have said this, I should have, I can't believe I let that person say this. And that is a reenactment. That's, and so when you feel that, then you need to ask yourself, okay, what themes were triggered here? I was talked down to. That person made me feel incompetent, and again, if you have this reaction, it's like incompetence, you can bet the house that there are a lot of experiences in the past in which incompetence was insinuated, was targeted, was reinforced, and that person believes it. And this is why this minor moment will go on for days and become a big thing. And I think you notice in the trauma context, if you have an anniversary date of a passing of someone, everyone recognizes you can feel bad for 2 to 4 weeks after that. That's understandable. But in everyday life, no. Everyday circumstances, no. So it lingers. If you're out of sorts, then you're almost like it's a sure thing that something has been triggered in terms of your sensitivities, and you're now recognizing. See, we don't go through life and go look at an argument with someone. He's angry with so and so, but no one goes, "Oh, hey, that's bullying." And if it's bullying, what's that person's history with bullying?
Right.
And so once you start to know the history, you might have a much better idea of what makes that person tick and why they're the way they are. And then ultimately, you target those areas and they learn to manage things better and they're much more better with themselves as a result.
I'm really fascinated by your idea of treating themes. I've never heard of that
I
before.
know.
So you mentioned one example of like, let's say someone is talked down to, let's say in their home environment growing up, or let's say even more trivial, let's say every day, you grew up in a highly critical household, right? I think anyone growing up in an immigrant household as I did, maybe you did, that's kind of part and parcel. Where are you going? What are you doing? Put a sweater on, don't wear that shirt, like all of these things that we all grew up laughing at, but do surely leave their marks. So how would someone treat those things that are, I think some of us would say are more trivial compared to like big T trauma things like sexual
Yeah.
abuse and
Okay.
alcoholism in the house and things like that, that is a lot more stark and what we know needs to be worked on. How would you treat a theme like
Okay.
growing up in a critical household or being talked
So
down to, like things
that's
like
a
that?
really good question. So if we compare, we'll keep the same theme being talked down to. You'll compare a theme, we're going to compare a family in which there were a lot of traumatic events that happened. So, abuse of any kind, parents behaving poorly, and growing up with being called names all day long and made to feel less than. We'll compare that to a background where even higher SES, you know, but it's competitive and it's authoritarian and it's you need to perform, you
Sorry,
need to do
what's it?
well.
CS.
Socioeconomic status,
Okay.
money of a
Okay.
higher back financial background. So because people think it's like if there aren't any traumas in the history, you're good. No, we could come from very good families and we can get some very good coaching that's well intended.
Hmm.
You're good. Just work harder. Remember how important it is to be first. Be the best you can be. Don't make any mistakes.
Right.
This is good messaging, sort of, except when it gets distorted and magnified. So, so it's not a trauma history, but it's a different kind of history, and it has an impact. What is true is, on the average, the same moment. If we're comparing someone with a trauma history versus a non-trauma history, the non-trauma history is going to have a tougher time. But even people who come from non-traumatic environments can become very affected. The whole notion of perfectionism, you mentioned Western. We've had some in the past, some kids attempt suicide because they got a grade below 90, so it's taking that I failed. I failed. and it's all this coaching and this programming, that is not well intended or is well intended and has consequences, and what we're trying to do, those are all old habits. And what we're trying to do in identifying the themes is come up with new habits, reprogram the messaging, So instead of the first thought of saying, I suck, the thought might be, okay, how could I be nicer to myself? How could I be more caring, more nurturing?
Right.
It's hard. It sounds easy, but if you grew up in
No,
an environment that was not very nurturing, it's going to be hard to grow up and
reparent
be
yourself.
nurtured. That's right. Ah, bravo. Right word. Right
Okay.
word. It is reparenting. It is reparenting. And sometimes when you say that to people, they're like, "What? It's weird. I don't know what you're talking about."
Yeah, yeah. They're like, what? My relationship with my parents is fine. You're like, yeah, like, but two things can be true at the same time. Like you
well
can love
done.
your parents, they can love you, you can have a good relationship, but some of the things that maybe they pushed down from their generations still have left a mark from, the early nets, if you will. So
Yeah.
the
So reparenting is just that. Kind of like it's a bit out there, but the adult you
mhm,
gentling the kid in you, you know?
right.
And remember, you've been that kid longer than you've ever been the adult.
That's interesting. Can you speak more about that?
Well, it's 40 years of thinking you suck, compared to what? A month? A year?
Right,
More recently, you're doing better. And on the balance, you think that's going to tip the scale? No. This is why, as you know, some people, it doesn't matter how successful, some people, it doesn't matter how much money they have, they don't, they're not any more happy. They're not any more okay with themselves. They're like a bottomless well. They're trying to fill it up, but they can't. And they can't
right,
because of this kind of messaging, this
right,
kind of programming that, and remember, all those voices started with someone else and then it becomes your voice. So the inner critic, comes from somewhere. We tend to think of the inner critic as something that's been there in your head and you think it's yours. No, no. At 40, you don't say I'm ugly, stupid on your
right,
own. On your
right,
own. That's not how it works. That came from somewhere and almost always it started early. The truth is, we are all a product of some of the goofiness of our parents, some of their craziness.
right. That's a
Okay.
generous term. I like that. Yeah. Because
You know,
I'm I think there's probably a more descriptive term, something like dysfunction, but it's also not their fault. So I like the idea of labeling it as goofy because it kind of
yeah.
takes off a bit of the sting, being like, well, does that mean I'm dysfunctional? Does that mean? And you're like, no, these are things that I think I've been thinking of this theory that we're all in the middle of this giant, operating system upgrade for emotional awareness and maturity, but it's not evenly distributed, not by geography, not by social class, not by gender. It's kind of like who happens to get it and who doesn't, and who passes it down to their kids to, have a more emotionally mature centered life. And it's really interesting of in these contextual environments that we find ourselves in that we have to accept like, okay, I need to reparent. I need to be kinder. Go ahead.
Yeah, yeah. It goes back to, I threw money out, when I was talking about socioeconomic status. All of this stuff that we're talking about, Michael, is about survival. These are the things we do to survive. And all these things that we're describing are threats. They're threats to us. And the question is how do we deal with them? When you have traumas, those are harder threats to deal with. But the money piece offers you some power and some opportunities to put some emphasis on you, look after you. But if you're working 3 jobs to cover 5 kids, you think that person is sitting at home thinking about, what he could do to be nice to himself? It's not how it works. Can you name how many female philosophers are there in the world?
That's a great question. I don't know any.
Okay, so that means that it's the males who were navel gazing. Which males were navel gazing? Not the farmers.
No,
All right,
it was all
so
the
that's right. So this is so that there's an economic piece to all this,
right.
and so the ability to attend to ourselves and care for ourselves, is culture can be inhibited, because of it's like who's most disadvantaged in terms of medical care? People with less money. Unless you're culturally shaped to look at yourself, if you want, if you come from Nepal or some sections of Asia, you might have a different philosophy in how you look at yourself and how you try to take care of yourself. But in terms of our capitalistic side, it's not intended to really focus on taking care of those inner needs.
Is this the treatment that you're doing for reenactments? Is It seems to fit really well into the concept of self-compassion, which seems to be coming up in all sorts of therapy and even
Yeah,
performance coaching now, where I mean, if you've ever read Andre Agassi's book, and I've seen him in interviews talk about just how the top seeds in his category, the men all hated each other. Like they're in the same sport, they're the only ones that understand each other, and everyone was at each other's throats trying to win different Grand Slams, try to rank properly. And now, if you look at them, like the number 1 and 2 seeds who are so far above everyone else, they speak well of each other. They have dinner every now and then. Everyone is in. It seems an emotionally better place. Everyone has a mental health coach on their team, and
they've
it
grown.
seems like they've
They've
grown. I
they've
mean,
grown.
but it seems like even sports and society as we understand things realize that the path to performance either in sports or life kind of comes through the pathway of self-compassion. Would you agree with that?
Yeah, absolutely. That would be one of the things you would want to have as a foundation for a life plan, to continue to grow and evolve is to work on compassion, empathy, and loving kindness. That alone, though, here's the caution, that alone isn't going to change, the people who are struggling with reenactment. It helps, but alone it doesn't. And the treatment model that we come from is a very action driven model. Don't think your way out of something, act your way out of something. Do something to feel better after, not before. So for example, I think if you're talking coaching, you know, does someone sit around and convince themselves they have confidence and then go and do things? Or do they go and do things, test it out, do okay, and then go, hey, I can do this and get confidence. So in that respect, that changing your thinking alone, you know, won't necessarily make you more effective in everyday life. But as part of compassion, if every day you're practicing and you're meditating an hour a day and you're thinking, I'm sending positive thoughts to the world, and I hope everyone is good, I'll focus on my family, make sure they're good, and if you do all these things, then you focus on you, you know, all that is an action because that takes time, it takes effort. It's
Okay,
not it's not a switch in the head, that now I'm more compassionate. Human behaviors has the tendency to do things whatever's easiest. That's
sure.
why we're in trouble. That's
The
why we're
path
in
of least
trouble.
resistance.
That's past the least resistance, and why deal with what you need to deal with today if you can leave it till tomorrow? But the problem is anything you leave till tomorrow is there a year later, and so we're trying to really convey something else, an action driven approach to life, and something you hinted at earlier, a values based approach to life. All right. These have to come together. If 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 you're running over people with these actions and taking care of you and screw the world, that's not going to sustain itself down the road. So we're back to these values. And what are the values? Being nice to ourselves, being nice to someone else, do the right thing. Okay. We're in a world right now, we're very narcissistic, very individualistic. If you spend time in Canada, There's a bit more of a collective sort of identification, with our medical plan. And, there's, we sort of like, we tend to, okay, who needs some help, and then we look to ourselves. But the other model is, what do I need? The hell with everybody, and those values down the road are not going to help the world.
Right. Yeah, the concept is itself, I like that psychology is kind of seeming to evolve quickly in the last 20 years per se. There was a bit of the was it the reproduction bias that they couldn't find in different studies, but
Yep,
it
yep.
seems now there's a much more open mind to someone saying, okay, well, I mean, I would love at one point if the psychiatrist or this psychologist could be like a GP saying, okay, well, maybe you need more exercise. Maybe you need this nutritional wise. Maybe try some psychedelics, but these are the ones we think are safe that are proven. Like I would love to see that happen. So it's not all let's talk therapy for 20 years, which I think it seems they're realizing that the ceiling is lower than people thought for rehabilitation. Do you have any thoughts on that?
No, you're absolutely correct. The problem is it takes a doctor too much time to sit 15 minutes and make sure they explain how to eat properly.
Right.
It's too much work. Their thinking is 5 minutes, go see the dietitian, and so this whole microdosing thing, everyone is looking for a shortcut. And Michael, this approach that we talk about, and it's one of the first things we say in our book. If you're looking for an easy answer, this book's not for you. Move along. All right. And if you're looking for 10 steps to happiness, okay, move along. This is, because this model is reality based. It's
I like
world
that.
based. It's real based. And by that I mean you get a Nobel Prize, you get the Emmy, you know, you get that $1 million contract, you're feeling great, transformed, top of the mountain. What happens the next day? You eat, you go to the bathroom, you do things like you did, and life continues. It continues. And the challenges continue. The losses, the stressors continue. So we get lulled into this kind of looking for solutions that are quick fix. And it makes them think, yeah, it makes them think like one strategy. Okay, so you might not remember. Maybe you might remember in your day in London, we had one of our physicians who was an expert in reducing blood pressure, and his treatment was eating grapefruit. Grapefruit was found to be the cure for reducing blood pressure. Now, it does help, but let's be real. One item doesn't decide
Right.
blood pressure. All right. And so you think one psychological item is going to change that person's life? You think ignoring what the world says is going to fix you? How long do you think that's going to last, that approach of not paying attention to what the world says? You're trying to operate independently of that. It's not how we work. So it's important to recognize in terms of all this, the fundamental goal we all have and should focus on is what can we do to continue to grow and evolve as human beings until we die. Last night I watched Jane Goodall's bio on Netflix. I don't know if you
Right.
saw that.
No, I heard it was out there.
It was filmed just before she died, and it was her wish that this could only be released after she died. She's in her 90s and still kicking ass.
Amazing.
Just, this is a person who has lived and pursued her life in a manner that she has continued to grow and evolve. So that's not 10 sessions.
Yeah. That's great. Yeah, because I mean, I guess to put together two parts. I mean, of what you've said, and also things I've been thinking of over the last few years, is that self compassion is such an important thing after these things, so we don't have to beat ourselves up and kind of keep putting ourselves, down and you know underground, if you will. But taking action is the only thing that changes something. Like the people says time changes a lot, and I don't know if I agree. I go, time moves on. Like we have to change things. We have to take action. We
Right.
have to make our
That's
lives
right.
different. Like if we just keep waiting for time, circumstance will kind of just steamroll us right over. And so, how would you? I guess people that you've worked with that are going through this, because yeah, it is still difficult, but it is easier to journal or meditate, etc. So how do you get people over the hump from doing these things that they can do in their mind to actually taking action in their life, so that either the reenactments are different or that they're taking different steps every day? Like, is there any sort of lever you're teaching people to pull that they can, take one step to the right instead of every morning they're taking a step to the
Yeah.
left?
I think the first thing, just what I was doing earlier with you, the first thing you have to do with people is to ask or tell them to get real. Get
Mm,
real. And by that I mean, so the last 5, 6 years I've been working in a unit where bariatric surgery is performed and working with people who live with overweight. They use food the way people use alcohol, cigarettes, gambling. These are all addictive behaviors. And it's incredible how often they come in and they have this magical thinking that even if they've done 12 diets and failed all those diets, that this next diet is going to be the new thing and it's going
right.
to work. And so when you confront them with the data, and they get to acknowledge, you're right, this doesn't work. Okay. Now you have a chance to move to something else and to show them something else in terms of how they can be. And the thing is, if you don't show them something else, what are they going to do tomorrow when they're stressed? They're going to eat. They're going to eat. They're going to eat. And, the person's going to drink. They're going to drink. They're going to do the things that, again, short sighted, but lead to significant problems down the road. So when you start to talk about, look, this is old programming, this is new programming, or old habits, new patterns, the language, in our current zeitgeist, you
Right.
know, and so you go from old to new, you know, and then there's the reality of new habits don't happen in 2 months. They just don't. And so you have to, the longer you keep that habit, the more it's with you, the more you use it. But you need to think of more in terms of a year or 2 or 3 down the road. And so so we talked a bit about this is the reenactment. Your question is, how do we break the reenactment? And the way to break the reenactment is to do anything, so long as it's different than what you would always have done in the past. Anything. So if in the past, every time you get stressed, you would pick up some food, then what would be the something new? Do we go for a walk? Do we go exercise? Do we meditate? Do we journal? This is the thing I do a lot with people is because they think they all can talk about emotions, but when you ask them what emotion, I don't know, maybe some anxiety. Okay. What anxiety? Anxiety about what? It's this nebulous thing,
Yeah.
and you can't target this nebulous thing. If a person's anxious because their marriage is failing, if they're anxious because their two kids, with fetal alcohol syndrome or autism, just difficult to manage. If the stress is due to being close to being homeless, do each of those situations have the same treatment model? No, you're gonna have to
Unlikely.
do,
Yeah.
yeah, not likely. You'll have to do something that targets those specific issues. So doing anything that's not eating would be good, and you can sort of set them up. There's so many different things you can do. The challenge is find the medium. Do what works for you. I got some patients who swear by journals, and then there are patients like they can't do it. They just,
Right.
it's not, and instead of, chastising them or making them feel like you're doing something wrong, what you need to do is, okay, let's find your medium. Let's do something else. And so somebody else, it could be woodworking. If that's their meditation,
Yeah.
then away you go. And so if you woodwork instead of eating, and by the way, you talk about self-compassion. Is woodworking self-compassionate?
I mean, I think it could be.
Yes,
Yeah.
yes, yes. It's how the person sees it. If you do something caring for you and hits the spot, then the chances of that leading to the breaking of the reenactment and feeling better and feeling more comfortable with ourselves increases.
There you go.
Okay.
You cut out a little bit.
Okay.
Yeah. I mean, on from what you were saying, that is there any way that you've seen in your practice that seems like a commonality for people that they realize a reenactment's coming up? Is there something in their body that people can say like, "Oh, I'm about to do this thing I don't want to do,
Yeah.
and now I
All
need to
right.
go woodwork for half an hour or
All right.
something."
So I'll give you the 5-step version of all this.
Okay.
First, you have to be aware. So before that question, a light has to come on and go, something's up.
Mm,
Something's up. I'm feeling something. I'm out of sorts. And so awareness is important. And we have people do things that increase awareness as part of practicing. So journaling, meditating, walking, all these things increase awareness. Therapy increases awareness. So, second thing you do in a moment is something happening. Second thing is do something to regulate your physiology. When you get triggered, you get lit. What's your thinking going to be like? Not good.
reactive.
Yeah, reactive. 2 plus 2 might not come to 4 in that stage, that
Right.
window. And so you have to back up, go to think about it again, go for a walk, bring that physiology down. Third thing becomes okay, now this is the moment. What are the themes possible contained in this? Knowing my sensitivities. Shoot, this got triggered, this theme, and this theme. Michael, we all have reenactments and we all have them every day. We just don't know it. And so that's what this awareness thing does. And paying attention to this is you start to notice these things. So you identify the themes. And then after you identify the themes, what's your plan going to be to take care of this? What is your strategy going to be? And then you execute the plan. And then, like any plan, what worked, what didn't work. And remember, you'll have another chance to do this again. Why? Because it's going to happen again, and
Right.
again. What'll happen when you do this work over time, it will happen less frequently, it will happen less intensely, and the time between episodes will increase. You'll just have a better sense of what is going on with you, and you'll be managing yourself, in a more effective way. But it's just follow those steps. The challenge is the plan, and that's where it's not a one plan fits everyone. No, it has to be custom to that person, custom made.
Well, it's funny because I keep thinking about your idea that like you've been this kid with these ideas for longer than you've been who you are. And I mean, that's definitely going to stick with me after this chat because I think it even allows us to have more self-compassion for ourselves to be like I shouldn't because I mean, especially if someone's fighting perfectionism or things like that, I mean,
Yeah,
you think like, "Oh, I should be able to fix this in, 2 sessions or a week or even 2 weeks." To I mean, even to speak for your point on grief that well, no, this I was taught to deal with this or this is a big issue. I need to give it some time. So I think that's an even more helpful way to I'm learning a completely new skill
yeah,
that that is
yeah.
that is not in any point in my neural pathways right now. So I have to continue trudging this ground until these neural pathways start to fire stronger and stronger and stronger to make this part of our life.
And the why is really important. It makes a difference. Knowing the why of your behavior helps with changing it.
Okay.
So, for example, all kinds of diets for everyone in the world. Any of the diets address why people eat. Good
I'd say
luck. Good luck.
there has to be one out there. I mean,
No,
probably something online about emotional eating or something like that.
no, they'll mention that. They'll mention that, but they won't. There's no why.
Mm,
You know, again, if the why is because you learned to eat, and what triggered that that coping response was you were abused as a kid, all right, and you think somehow that if you put on weight, nobody's going to pay attention to you, and that's your solution to why. That's a different conversation than if your why to eating was a way to just reward yourself, and you would sneak food away into a bedroom and just sort of it'd be the only positive moment in your life. Right? So the whys become extremely important. And it's in therapy. That's where the work is. And once they get the why, it just changes the perspective. Not knowing why, it just makes it that the programming always goes the same way that it always. And what's a bit silly is they make the same mistakes 3 times in a row. They're in the same crappy relationship 3 times in a row, and they go, "I don't understand. I don't know why." "What do you mean you don't know why?" Right?
Right.
And why might be because you grew up with parents who fought all the time, and one might have been seeing someone else. You grew up with the betrayal, all these things, and that might be why you are the way you are. I think you're very familiar. You mentioned Feldman, attachment. It's just some attachment, neurobiology of attachment. And again, there's a biology, but there's also an environment that shapes what kind of attachments we're going to have. All right. So if we have parents who have problems of their own, can't really attend to kids, what kind of attachment are you going to have? It's not going to be great. And it's going to be hard to and so when they're having problems, they can understand why they're having problems because of this. And sometimes people think, oh, you just want to blame the past. No, 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 no. This isn't about blaming the past. When we make these connections, this isn't about, let's rehash this another 1,000 times, no. It's so that you understand this came from somewhere. This came before it ever
Right.
registered in your head.
It didn't just fall from the sky.
Exactly. Exactly. And so then it helped, like you said earlier, it helps them to go, so it's not all me. No, it's not all you. All right. But now that you know it is you, now
I
you,
love that. I love that. Yeah,
yeah,
because I've had this conversation. I was doing research for another project, and it was myself and this woman, this PhD in South Africa, and we discussed culture a lot, how it related to masculinity, etc. And obviously, South Africa, there's a lot of like, political turmoil over the years, a lot of oppression, a lot of like really horrible shit over the last however many hundred years. And the conversation we had was she believes also like you, maybe a little bit more strongly, of how important it is for us to understand where all these things came from. Right.
yeah,
In the
yeah,
case
yeah.
of somewhere like South Africa, it's like, okay, there was apartheid, there was colonialism, there was all of these things that happened that has added up to what that country is today. And the part, I mean, she taught me so much, I could go on forever, but the part that I did push back on her a little bit, and it became a bit of a joke when we had these sparring matches, was that at what point is culture and history, all these things important, but then at what point do we have to take responsibility for ourselves because we are here today? And I don't even know if there's an answer to that because it's such a complex question, especially in terms of a country's history. But when it terms of like personal therapy and people, I think it's around where you said it, that like as soon as we become aware of it,
Yeah, yeah.
it becomes our responsibility to change it and be like, okay, these people were as they were because of what they've gone through, etc. And you know, there's intentionality and there's blame and all of that discussion as well. But it's more important that we're not stuck in this concept of these things may have happened to me, big or small, and I am a victim, because that becomes identity. And I think once there's an identity attached to it, I think it takes away a lot of agency. And I guess, are you seeing that as well in your practice?
Absolutely. And the past is in the present. This is the problem.
Right.
And so once I'm not gonna say like 100%, but once a person sees it, they almost can't unsee it. And so that there's a moment there of recognition that, oh, I can do something, and some people debate, do we have free will or not? But I think there's free will in caps or small free will. So in caps, free will is the belief you can do whatever it is you want at any time you want.
Yeah.
That's a good idea, but the reality is people are born in with biology and they're born into environments, and those things have a lot to do with you know
Yeah.
directing, and you can I think at the very least in a small free will way dictate how you're going to react to what happens to you,
Hmm.
recognizing you're influenced by everything in the past, but you can change how you react to this. It gets at that Viktor Frankl thing. If you see meaning and purpose in your suffering, then this is good. Otherwise, it's just torture. And
Right.
and the person just swims in this toxic pond all day long, and of course, then they take on I don't want to say it, but like a kind of a victim identity, and that's no one's helped. No one has really helped. It's good to acknowledge and recognize and help them, you know, but I got to tell you, these days, everyone wants to be assessed for ADHD. Everybody wants Vyvanse. Everybody is convinced that they have an attentional problem.
Yeah, I mean, with all this phones, I think we all have something a little bit these
We
days.
all have something a little bit, yes. What a lot of people don't realize when they're doing it in here, when I see them, they have PTSD. That's what they have, not attention deficit disorder. If you have PTSD, your thinking can't process. That brain.
Can you draw a line for me between, and maybe they're the same thing, between a reenactment and PTSD? Is there a difference?
No, PTSD is just one kind of reenactment. It doesn't have to be PTSD. It could be
Right.
everyday experiences, and it's a reenactment, And so it's just that PTSD is your more extreme experience that can really lead to some major reenactments.
Okay. Okay.
But
So it's
PTSD is not being able to regulate your physiology. And if you can't regulate it, what's the most common problem for war veterans? Substance abuse. Why do they have a substance abuse problem? They're trying to regulate their physiology so they can manage these thoughts, these feelings, these emotions, these dreams, these experiences that go through their head. All right.
right.
So it's because they can't think, they can't function when it's elevated. All right.
I
So
think even if it's not substance abuse, I think everyone on some level is trying to regulate their emotions. I mean,
yes, 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 yes,
people are
yes,
doing
yes.
it through Instagram and TikTok. Others doing it through extreme exercise. Others doing it through sleep. I think like we're all just drudging along, trying to do our best here. And so I think some people pick up habits that are more constructive, and
What's a
some
work
pick up
ethic?
ones.
What's a work ethic?
What do you mean? What's
A
worth
work
it?
ethic. What's a good work ethic? Working, just making sure we work, we make money. It's we're like this work ethic, this
Mm,
work behavior is an adaptive, good way of regulating our physiology. If you work 10 hours a day and you go home, you think you're going to be revving? Not likely. You're going to be
myself, probably
tired
not, but I know plenty of people that do work a ton and they've had 7 coffees and they get home at the end of a long day and they
and
need to
eventually
have,
crash. Yeah.
crash, but also or have some sort of other substance to down regulate to be able to sleep and then go and do it all over again.
Either way, it's mismanagement of the regulation. But I was just trying
Right.
to use a good, an adaptive, a well recognized coping response, which have a good work ethic. If we
Right.
have a good work ethic, no one questions us. We're good. I'm this, I'm that, and we get reinforced. And I think 10 years later, 20 years later, you go, Jesus, this is a bunch of bullshit. Like
Right.
what am I doing? What am I doing?
Yeah,
This is not working.
I think the concept of work as passed down, I think from the Victorian era, the Protestant work ethic, the British Empire, like, you know, shut up, go to work, stiff upper lip, nobody, don't talk about emotions, all these things. Like all of this is having a bit of a reckoning right now where people, I think if you go to a job you like and you come home after 10 hours, you're exhausted, but you probably had a decent day. Whereas if you're in the drudgery of, I mean, I think all of us has some friends that have, in the legal work that have like, it's brutalizing. They've had a 12-hour day, all these
Yeah.
things that maybe they're not seeing the purpose in their life. They're like, why do I need to work all these hours? I think people are coming home and then you have to deal with you have to do it all over again. And so there's all these things with work that I think is, I mean, I don't know if anything's going to change. I mean, if you look at different cultures right now, I mean, I have friends that go to China to do work on projects there, and like the work ethic there is just out of control compared to
So
Europe or even
now
North
I'm in a
America.
medical hospital.
Right.
The foot in the door to see me is a medical problem. So that first heart attack is probably going to be the first moment that's going to get their attention. And
Mm,
they're going to recognize, oh, this is not working. I got to rethink this, and as just an example, there are other medical complications that can occur as a result of this approach. You can think of, for some people, work is an addiction. They do it like they do everything else. And it's all about that. Ah, that letting down. But like anything else, if you take it too far, it becomes a bad thing. It's a bad thing. So you've done a really good job today of you have behavior and you're trying to contextualize all the stuff that goes into that culture, values and all those things, family, and they're all
Right.
part of who we are. And it goes into the analysis in trying to figure ourselves out.
Which makes it that much more complicated.
Right. Which is why one one technique isn't going to fix anything. Oh, and I think this is something that we really have to get around. I think a good example is, you know, do these 5 steps and you're going to be happy. And it's like, think about this. If it were that simple, don't you think someone would have discovered this in the last 5,000 years?
Yeah, and the thing is, even if it's simple, doesn't mean it's easy, right? Like
That's right.
so that's the
Yes, yes,
that's the hard part. I mean,
yes.
I mean, I want to shift gears a second because I was reading something when I was reading through different things about you, and that you're saying sometimes in practices, I want some helpful advice for people that are in couples right now, especially because I think you people get probably the most reacted when they're in these relationships they've been in for so long, when love is involved, and high stress situations, etc. And so, in a lot of these things, I think a lot of people over time, couples, family members, etc., people keep replaying the concept of them not being heard by the other person, right? Like I'm sure being around someone for
Yeah, yeah.
5, 10, 15, 20 years, I think you start developing filters in general. So there's probably a little bit of truth to that. So I guess, but people that are in that environment and they think that they're not being heard, like that would end up coming up as a reenactment because it's something that you feel activated by, triggered by, that it's something that continues to come up. Is there a way for couples to I mean, even friends and family, but is there a way for people to manage that sort of interaction properly to get back to a place where they both are feel heard, or how hard is that?
So let's start with an example. A woman is upset with her partner. He's a mechanic, works hard all day long, comes home, and it doesn't matter how much he washes his hands, it's stained. She has told him many times, do not use the fancy towels in the bathroom. They're for show. Use these other towels. He forgets. This is the foundation for a major disagreement between the two of them. If you look at this on the surface, this is trivial. Talk to her. Her experience is this reminds me of never being heard or seen by people in the past. I tell them and they don't listen to me. It makes me feel worthless. Now, when you go, that's what that makes you feel. Then the partner goes, oh, no, sorry, hon. I just wasn't thinking. I just didn't know. And so understanding her background and why. But again, Michael, you ask her, why are you upset? She's not going to say she's upset because it's been a history of not being listened to. She's going to say, you know how many times I've told him? How many times? And he still does this. How am I supposed to take that? That's about it in terms of the analysis. So she's got her stuff. He's got his stuff. And that's where what do you do is, well, in this context, you can go see a couples therapist and that would help because you're using someone else to negotiate and to sort of navigate these challenges and a back and forth. So that person would have to know the history of both persons, make it obvious to both people, and then have them, come up with different ways of interacting. All right. So how many times do I have to tell you? This is what she always says. How do you break that reenactment? One way to break that reenactment would be, hon, let's go sit down. I want to talk to you a bit. All right. I want to talk to you about this. And I want you to get to understand something. When you do this, it makes me think of my dad and my dad just not giving a shit about me and just, ignoring me. And when you do that, that's how I feel. And he'll go, what? You never said this. And
Right.
so then, Michael, if you get that story and our guy behaves the same way, anyways, oh, we got big problems. That's the least of their problems.
Right.
But if he goes, I'll do my best. I will try to, now that I understand, you know, one of the more common things in couples that I see is one of the two people was sexually abused. So for that person, sometimes it's okay to have physical intimacy, and sometimes it's not okay. So a guy goes, "What the hell's going on? What's wrong?" And that person doesn't know that sometimes when they're in a good place, when they're in charge, when they're more adult, they're good. But when they've been triggered and feel partner comes along behind, accidentally puts his hand on the lower back and startles, and this feels like it's a reenactment. This feels like another experience. So the complexity here is to sort this out, share it, and then come up with new patterns of behavior so that and the most important thing actually, if there's anything that I think everybody should remember, the best way to break a reenactment, honestly, is just talk differently, say it differently, say something, but communicate. And sometimes we have to learn how to do that. But if you communicate differently, the world will respond to you a bit differently with some understanding, and then they can work harder when they understand the whys. The whys are very, very important in getting people to change their behavior. Otherwise, you're being ridiculous. What's wrong with you? I didn't
Right.
do anything wrong. I didn't do anything wrong. So you're asking I'm realizing that you're asking good questions and they are designed to sort of have a listeners maybe they can use in a quick way. It's a strategy. And I'm thinking, geez, I don't have a really easy answer that will fit that, you know. And so I give you some case examples to kind of show the
Yeah, that's great.
complexity, so that you realize, oh, this is a little more than we thought. Hell, we're just recognizing in the last 10, 20 years the role of attachment. We didn't talk about attachment, 20 years ago, in
Right.
relationships, and we're starting to do that more. And that really helps a lot in understanding relationships. And so the childhood experiences shape the attachment experiences down the road. You can change some of that when you're aware of it, but you have to recognize you didn't learn how to be with someone else when you're 25. It, it it started way before. And so so we're trying to keep simplifying it and I keep complexing, trying to
Yeah. Well,
capture more of
and I
the
mean, even if the attachment styles from the parents were favorable, but then your first or second or both of your first real relationships in love are
absolutely,
disastrous. I mean,
absolutely.
like, you have a series of people cheat on you, or if someone goes through some sort of sexual abuse or something like that in those first relationships, let's say even when you are in your teens or 20s, I mean, I would imagine those are going to override many positive experiences from your childhood. So it's so
And
I
Mike,
don't I was sorry, I was going to say that's why I understand, or I'm not surprised you don't have any quick 5 tips that are going to get you there, because as I think most of this conversation has been based on, everything is so complex. It's really going to take time to completely update your entire operating system. So when someone says something to you
that's right.
that sounds like that person in your life in your past who was a complete nightmare to you, you don't think it's them in someone else's voice. You realize it's someone else with a different intention, with a different, all of these things. And yeah, I can imagine how complicated that would be to change for all
It's a
everyone's
really good
different
analogy.
triggers.
It's a really good analogy. This is a total new program. This isn't that little fix you do once a week on your cell phone,
Right.
to fix the little niggly problems that a software program has. This is a major reprogramming, it's a different language altogether when you start to realize what's in play and what your approach is to it. And then if you can do this in life and continue to grow and evolve, then you could start to tweak things, once it becomes part of you. But it's always going to be a lot of work.
Well, I mean, thank you very much for your time. I'm going to go out and grab the reenactments book. I wish you all the best of luck with it. And if I'm ever in London
In London,
revisiting the
yes,
campus,
yes,
I will
yes,
knock on your door.
yes, yes. Great.
Is there anywhere else people can find you if they want to look up your work more? Or
Yeah, just put Tony Iezzi. You'll see. In terms of the web, but in terms of the best way to get to me is my website, Tony Tony iezzi.com. And you'll see where you can get the book. You'll see some other things there. There's some videos, there's some blogs, it's all about different pieces of what we talked about today. I think the book will be uh, a good summary of this, and I'm looking forward, and I welcome everyone to send me whatever their thoughts are, and because it's a bit different. And I know this because working with patients, the first reaction is usually like concrete. What are you talking about? I don't get it. It's a bit like when we took English Lit, 40 pages of Thomas Hardy, describing the forest, and what are the themes? What do you mean, what are the themes? But it's like, no, it's loneliness, it's isolation, it's disconnection. And so it's going from concrete to more symbolic. So, hey,
Okay.
thank you for having me.
No, thank you. I'll put all of your websites in our show notes so people can find you easily. So thanks very much for your time.
Great. Thanks.
So thanks for listening to No More, No Less. I appreciate the time you spent with me today. So please subscribe and rate the show if you enjoyed it. It'll help me create more amazing content and get that next little bit of validation that I so deeply crave. If you did enjoy it, well, that sucks. But to make sure, I think you should listen to my next 10 episodes and then decide. I mean, come on. Rome was not built in a day. I'm just getting warmed up here, guys. So thanks again. See you next time.